My name is Helen Brough and I am a consultant in paediatric allergy. In my NHS position, I work at the Evelina London Guy's and St Thomas's Hospital, where I am the head of the clinical service for this department. I am also an adjunct reader at King's College London University, where I do some research and teaching. In my private practice, I work at the Portland Hospital, which is in Marylebone, and at ENT for Kids on Wimpole Street, also in Marylebone. I'm also the chair of the paediatric section for the European Academy of Allergy and Clinical Immunology. I chose to specialise in paediatric allergy, firstly because I have always been drawn to paediatrics, and I initially trained as a general paediatrician, and I had a broad range of training in multiple different specialties. I then realised that allergy was a really exciting and very quick developing specialty where there was lots of research happening. And I really enjoyed that combination of research and clinical application of research. What I also liked about allergy is that when you see a patient who has allergies, you are being a specialist doctor, but you are also managing many different areas of that child's condition. So I will manage eczema, which is the allergic manifestation in the skin. I'll manage asthma in the lungs, allergic rhinitis and conjunctivitis in the nose and eyes and ears. I'll be managing delayed food allergies, which affects the gut. And I'll be managing other types of allergies like drug allergy and venom allergy, and obviously food allergy. So although I'm a specialist, I'm able to provide holistic care because I'm able to address all the different parts of the body and all the different ways in which allergy can affect a child. Well, what I find rewarding about my job is that paediatric allergy is an amazing specialty in terms of the advances that have been developed only in the last 5 to 10 years. We know that allergies have gone up dramatically over the last few decades, and because of that, and myself included, all allergists are actively involved in research to try and ensure that there is progression and that we're able to do more for our patients. So, for example, there is now, we know how to prevent food allergy, and that's something that I actively practice in my clinic. We also now are developing really effective treatments for food allergy. And again, that's something which is really exciting to be able to implement in clinical practice. In terms of what I find most rewarding is that when I see a patient, I'm able to see them implement the various strategies and then see them again and then be able to see how much they've improved and see that the impact that has on the child, but also on that family's life. So you've asked me what patients value most about me, and I think I'll refer to some of the reviews that I've had on various portals. The one that often comes out is that I'm very thorough and dedicated, and that I have a really approachable manner with the children. Also that I am available after the consultation for queries, and the effectiveness of my treatment. So many patients write that their child's delayed food allergies were really dreadful, and now their child has very few symptoms or no symptoms. Many patients come to me with very severe eczema, which actually with quite straightforward medication and careful eczema management can drastically improved in a matter of days, and they often are very happy about that. Asthma is also really easy to treat effectively if you know how to treat it and you provide patients with the right management plan. And allergic rhinitis is also very easy to treat if you know how to do it. And the immunotherapy that we do for allergic rhinitis is very effective. And also the immunotherapy that I've done on several patients now for milk is really effective. I have patients who are now having 250 mils of milk a day, whereas they couldn't have even traces of milk before they came to see me in my practice. So you also asked me, what do I value about my patients? So I mean, I value the fact that the patients I see really want to make their child have a better quality of life. I'm always astounded as to how much they will put into action all the different strategies, and they see their results, and how that helps them and their child. I also like that my patients are often very well informed, and they've done a lot of research into the topic themselves. We have some really interesting discussions in clinic about this, and I'm always learning from my patients. They'll tell me something and I'll think, oh, that's really interesting. I hadn't thought about that association, and then I'll be able to learn a bit more about that. For example, new food allergies. We're finding out about new food allergies all the time, and I'm learning this by meeting patients and seeing what things they're reacting to.